Okay, shall we start now?
Yes, ma'am.
Okay.
Okay, ma'am.
So, like I have explained about the definition and the differences between diarrhea and dysentery, right? Then after that, I have taught you all about the classification. Now, so I would like to revise classification because many of you were absent yesterday, now. So, and whoever were present, it's just revisions for you all. Is it okay?
Yes, ma'am.
Is it okay, Gayatri?
Yes, ma'am.
Okay. Okay, so yesterday, like I have discussed about the classification. Okay, so diarrhea can also be classified into three subheading. Okay, that is first is on the basis of duration. Means like I have the slide in my laptop and I did not bring my pen drive. Not sure I cannot save it, so I could not show you all the slides. So I'll just read it out. Okay. So on the basis of durations, so first is on the basis of duration. So when you talk about durations, what is duration? So diarrhea is classified on the basis of duration. Duration. Gayatri, as you have attended, can you please tell me what is duration?
Ma'am, time.
Yes, very good. Durations means now for how long it lasts, for how many hours, for how many days. Okay, that we call it duration. So on the basis of the duration, the diarrhea is classified. Okay, so the diarrhea is classified into two types. You can write it down. Okay, just the point. The notes I'll give you all. So number 1 point is acute diarrhea, and what is the second point, Gayatri? First is the acute diarrhea. What is the second point? If one is acute, what will be the other one? The opposite. Okay, Jiban, what will be the opposite of acute? Okay, Carly, what will be the opposite of acute?
Chronic, ma'am.
Yes, very good. So on the basis of the duration, diarrhea is divided into two types. One is acute diarrhea and one is chronic diarrhea. So now, when do we call it as acute diarrhea? How will we come to know that the diarrhea that the person is having is acute or it is chronic? Okay. So the meaning of acute diarrhea is that when someone is having a loose motion, okay, which lasts for less than 14 days, then we call it as acute diarrhea. Means उसका जो diarrhea है ना, उसका जो loose motion है, the episode of that diarrhea, it lasts for less than 14 days. Then we call it as acute diarrhea. Are you clear, all of you?
Yes, ma'am.
Ma'am.
Okay. So what about chronic diarrhea? उसका opposite होगा. What will be chronic diarrhea? If the diarrhea lasts for 14 days or more than 14 days, then we will call it as chronic diarrhea. Are you clear now?
Yes, ma'am.
In a week there is a 7 days, right? In a week, from Monday to Sunday, in a week there is a 7 days. So 7 to the 14. So 2 weeks. Okay, when it lasts for less than 2 weeks, then it is acute diarrhea. If it is more than 2 weeks, then we call it as chronic diarrhea. As simple as it is. Okay, that is how it is classified. Okay, on the basis of duration. So coming to the next, diarrhea can also be classified on the basis of clinical presentation. Clinical presentation. Clinical presentation means like clinically how you observe. It's by observation. Okay, the way the stool is being presented. Okay, clinically presented. The way we observe. Okay, so it on the basis of clinical presentation, diarrhea is again of two types. Okay, one is acute watery diarrhea and the other one is acute bloody diarrhea. Okay, acute watery diarrhea, acute bloody diarrhea. So let me ask you all, what is the other name of acute bloody diarrhea? Someone is having diarrhea, but it is a bloody.
Melena, ma'am.
Okay, melena. Okay, means like, okay, melena is when you have when there is a presence of this blood in the stool, right? Yes or no?
Yes, ma'am.
Okay. Okay, so acute watery diarrhea. So acute watery diarrhea, when we call as acute watery diarrhea, when the diarrhea it lasts for several hours or even if it lasts for days, okay? And this type of condition, this acute watery diarrhea, it mainly occurs in a condition like cholera. Cholera, sunana? Cholera? Cholera.
Yes, ma'am.
Okay. Cholera is what? It is what type of disease? Is it a waterborne or airborne?
Waterborne, ma'am.
Waterborne disease. Okay. So when someone is having a problem of cholera or someone is having is suffering from cholera, na? So on he or she is having a chances to develop acute watery diarrhea, okay? And that particular diarrhea which is caused by cholera can last for several hours or it can also last for a day. So that is how we call it. So what is the causative organism of cholera? Obviously cholera will be caused by some bacteria or some virus, na? Any idea? Any idea it is caused by
Forgot,
what?
ma'am.
Okay. Cholera to everyone know, na? It is caused by one particular bacteria, okay, which used to cause infection. So the name of that particular bacteria, what was the name of particular bacteria? Gayatri? Gayatri, you know or you forgot? Just say that. Just say that. You know or you forgot? Gayatri? Means like you have attended the class, that's why I'm asking. Otherwise, I would have asked other student also. Shalin, do you remember? Shalin, do you remember? Suraksha, do you remember?
Yes. Yes, ma'am.
Yeah, say it. Say it, Shalin. What is the name of that bacteria, okay, that used to cause cholera? It will come in your final exam.
Yes, ma'am.
Yeah, what is
Can you please?
okay, no problem. I'll just tell the name, okay? This is Vibrio cholera, okay? Vibrio. Write it
Yes,
down,
ma'am.
please. I'll not give the notes, all these things. You just write down. Vibrio cholera. Vibrio. Vibrio cholera. Cholerae. Okay? Because these particular bacteria, this Vibrio cholera, it used to enter in our like intestine, okay, intestine, and then it caused infection in our intestines, okay. Because of that, a person used to have this acute watery diarrhea. ये bacteria का वजह से ना शरीर पे infection होगा, so it led to acute watery diarrhea. So are you clear?
Yes, ma'am.
Okay, now next,
Ma'am.
acute bloody diarrhea. Okay, that is diarrhea with blood in stool. We call it as acute bloody diarrhea. This one, it doesn't need for several hours, days, or whatever it is. Now, the condition will be same. The only thing is that when someone is having diarrhea and if there is a presence of stool, means presence of blood in the stool, okay, then we call it as acute this bloody diarrhea. Means like the diarrhea doesn't last for many months and all. If it lasts for hours and days, then obviously hours and days is just an acute, right? It's not chronic. Chronic means it's for many like months or so many weeks. We call it as chronic. So this is acute bloody diarrhea. So with or without the presence of mucus, it is also known. We can also call it as dysentery. Is it? Am I right or wrong? We can also call it as dysentery because dysentery is one of the part of diarrhea. Because diarrhea होगा लेकिन उसके साथ साथ स्टूल पे ब्लड होगा तो उसको हम dysentery बोलते हैं ना. Can we call acute bloody diarrhea as dysentery? Yes or no?
Yes, ma'am.
Okay. Okay. Next, That is the second classification. Okay, the first one was on the basis of duration, acute diarrhea, chronic diarrhea. The other one is on the basis of clinical presentation, acute watery diarrhea and acute bloody diarrhea. And now the other one is on the basis of physiology. Okay, yesterday I have explained what is anatomy, what is physiology. So Costa, did you remember what is anatomy, what is physiology? If not, I'll ask someone else, because on the basis of the physiology also diarrhea is classified. Any idea? Can anyone tell me what is anatomy, what is physiology, which I have
It's
asked
the
you?
study of bone.
Study of,
In anatomy, we study about bone.
is it, Carly? What Kostov is saying, is it in anatomy we study about bone? That will be the main meaning of anatomy?
Anatomy, study of parts, ma'am.
Study
Various
of
parts.
parts or the structure?
Structure, ma'am.
Yeah. In anatomy, we study the structure, okay? For example, if you study the structure of the human body, then you have to study both the external and the internal, no? External in the and the internal,
Yes, ma'am.
yeah, we have to study internally. We have to study all the different part of the organs, and externally how you look like. That is the structure. For example, when you study about the kidney, ना, the kidney का structure कैसा है, उसका उसका parts वगैरह ना, वो सब कैसा है, वो सब you will study in anatomy. लेकिन किडनी कैसे function होता है, what is the function of kidney, that you study in physiology. So anatomy is all about the study of the structure, both internal and external structure, and physiology is all about the study of that particular structure. Na? Study of that particular structure means the function of that particular structure. Are you clear, all of you?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So now on the basis of physiology, okay, diarrhea is also classified into 5 types. So this is not that much in required also but still I want you all to know. So if you just know the name also, it's okay. So on the basis of physiology, na, like diarrhea can also be classified into 5 types. So number one is secretory diarrhea, secretory, Secretory, secretory diarrhea, and number two is osmotic diarrhea, and number three is exudative diarrhea, number four is motility related diarrhea, and the other one is inflammatory diarrhea. So number one, let me discuss about secretory diarrhea. Okay, secretory, Secretory. So from the name itself, secretory diarrhea, it will relate on everything with secretion. Okay, all of you know now what is secretion? Secretion.
Yes, ma'am.
Okay, so secretory diarrhea. Okay, secretory diarrhea means what, how to say? There will be an increase in active secretion. Okay, or an inhibition of absorption in intestine. Okay, means in intestine all the absorption used to take place now, so the secretion used to take secretion also takes place now. But what happened is that when someone is having a secretory diarrhea na, the amount of secretion that takes place will be in a very rapid, or it will be in a very active or increased manner. Okay, so means जो secretion हो रहा है ना, active secretion, वो बहुत ज़्यादा increase होगा. Okay, as well as it will also inhibit absorption in the intestine. That is all about secretory diarrhea. Are you clear, or I'll explain again? Just remember like this, okay, that secretory diarrhea का मतलब है ना, that there will be increase in active secretion. Okay, and also the absorption that used to take place in the intestine na, will be inhibited. Inhibit सबको पता है ना? Inhibit. Inhibit. Any idea? Inhibition of absorption in intestine. Any idea? Inhibit. Inhibition of absorption in intestine. Any idea? Any idea?
No, ma'am.
Anyone?
Ma'am, self-consciousness.
Self-consciousness. Okay, what about other? What about other? Jiban?
Disturbance, ma'am.
Disturbances. Okay. Okay. Jiban, what about you?
Ma'am, prevent.
Prevent. Okay, this one I'll give you all a homework, okay? Or else I'll just say, means like inhibit means na, it is how to say, do you know what is restrain? Restrain, R-E-S-T-R-A-I-N.
Yes, ma'am.
Okay, what is restrain? Something that hold you back. What is restrain?
Yes, ma'am. Something that
Yeah, that hold,
stops
or like
or prevents.
from you want to do something, or you want to think something, or you want to perform something, but like it holds you back, ना restrain. तो उसको बोलते हैं inhibit. Okay, so means हमारा intestine पे जो absorption हो रहा है ना, secretion will be very fast, but secretion इतना fast होगा कि absorption, like the absorption, like how it used to absorb na the food and all na, like that it won't function like that. It won't absorb. The absorption will be inhibited, because if the secretion is in the normal flow na, it is in the normal flow, then to like absorption also will also takes place normally, but as the secretion is very very fast ना, तो उसका वजह से ये जो absorption intestine में होता है ना, that will be inhibited. Are you clear?
Yes, ma'am.
Okay. So, and then this secretory diarrhea na, this secretory diarrhea, the most common cause of this type of diarrhea is also called cholera toxin. Come in. Come in. Excuse me, okay? Just a second. What's cholera? Application. कब चाहिए? Oh, hello, student. Can you hear me?
Yes, ma'am.
Okay, so
Yes, ma'am.
sorry. Okay, my student came this way. Okay. Okay, so we were discussing about secretory diarrhea now. Okay, so the most common cause of this type of diarrhea is cholera toxin. Okay, this is also caused by this cholera toxin. So you can also write down. It is also caused by cholera toxin. Next, coming to the like osmotic diarrhea. Osmotic तो सबको पता है ना, what is osmosis? If you don't know also no problem. Osmotic diarrhea का मतलब है ना when too much of water is drawn into our bowel. Okay, जब हमारा bowel पे ना बहुत ज़्यादा water drawn होता है. Okay, so at that time like there is a chances of having osmotic diarrhea. Are you clear?
Bowel means intestines, ma'am.
Bowel, yes.
Okay, ma'am.
Okay. All of you are clear? All of you are clear? या फिर Clear or not? Yes.
Yes, ma'am.
Okay. So just remember now, osmotic diarrhea means when too much of water is drawn into your bowel. It is, as you know that now it is the intestine. Like the too much of water might be drawn in your small intestine. It might be drawn in your large intestine, because our intestine is also again divided into two types, now small and large. So it depends on where the water is drawn. Okay. So and then like for example, क्या बोलो, when if the child drink excess amount of sugar, okay, like when he drink excess amount of sugar का like solution बहुत ज़्यादा पिया, या फिर salt solution, okay, नमक का पानी, salt solution, okay, then what happen is that water will be drawn from the body into the bowel. Means just when excess intake of like this sugar and salt solution is mainly the cause also. So you can understand in that way. Are you clear, all of you?
Yes, ma'am.
Okay. Means like in some cases, not in every cases, this osmotic diarrhea also used to be the result of maldigestion. Okay, maldigestion. पता है what is maldigestion? Maldigestion, MAL, maldigestion.
Problem in digestion, ma'am.
Maldigestion. Problem in digestion. Very good.
Digestion.
Yeah, there will be a problem in digestion. There will be impaired in digestion, ना. So वो सब का वजह से भी ना like osmotic diarrhea होने का chances होता है. Okay. And then some people used to have this pancreatic disease and all, ना. Pancreatic disease. Pancreas तो सबको पता है ना, pancreas. Pancreas.
Yes, ma'am.
Okay, so when someone will have this pancreatic disease and all, so then there is also a chances of developing this osmotic diarrhea, okay? And then celiac disease, CELIAC, so na CELIAC. Have you ever heard? CELIAC.
No, ma'am.
Okay. Anyone? Jiban, have you ever heard celiac meaning?
No, ma'am.
You did not heard in anatomy physiology also, never ever?
No, ma'am.
It is mainly relating to your abdomen, okay? This celiac का मतलब. You can write it down, relating to the abdominal cavity. Okay, so that means I'm just adding all these things, okay, just for your knowledge, like क्या क्या हो सकता है ना, क्या क्या like क्या problem होने से osmotic diarrhea हो सकता है, वो सब. Okay, next is exudative diarrhea. EXUDATIVE, exudative diarrhea. So exudative diarrhea का मतलब है ना, like this particular exudative diarrhea, it includes the presence of blood and pus in stool. So like when someone is having exudative diarrhea, there will be a presence of blood and pus in the stool, okay? Then all these presence of blood and stool, blood वगैरह क्यों present होता? Obviously internally, okay, if you are having some inflammation in your bowel ना, तो हमारा बावल में like small intestine या large intestine पे अगर problem हुआ, inflammation हुआ, तो their bleeding will occur ना, and that particular blood will enter into your, means will pass out to your stool. Okay, so this exudative diarrhea, it occurs mainly due to the like inflammatory bowel disease, you can say. And what was the name of that particular bowel disease is also there, like corn disease. Corn disease. You can also write CROHN''S. All these I'll not give you all. It's just write down for your knowledge. But it will come in your exam. Corn disease. CROHN''S. Corn disease. Corn disease. Because when someone is having a corn disease, that means like this corn disease, it mainly inflame your bowels. Okay, it mainly inflame the bowel. Because of that, like this inflammation occur. Okay, and there is also another disease, ulcerative colitis. Ulcer तो पता है ना सबको, ulcer, ulcer, ulcer
Yes, ma'am.
सुना, ulcer. So ulcerative colitis,
Yes, ma'am.
and because of food poisoning also. Okay, because of food poisoning also, food poisoning का वजह से भी like there can also be inflammation in the bowel. Okay, in our bowel, food poisoning का वजह से भी हो सकता है. And there are other like severe infection भी होता है, जैसे कि E. coli. E. coli सुना, E. coli, E. coli.
Yes, ma'am.
Yeah, E. coli. What E. coli is, a gram negative or gram, or E. coli is what? It is a virus, it is a bacteria, or it is a fungi. What is E. coli? Yeah, E. coli is a bacteria. Okay?
Bacteria, ma'am.
Yes, and bacteria are also again classified into two types. It used to be a gram negative bacteria, gram positive bacteria. वो सब सुना? Have you ever heard that bacteria?
Yes, ma'am. On your last class.
Okay, okay. So E. coli, it used to be of gram negative, gram positive like this. Okay, so E. coli is a gram negative bacteria. Okay, so we call it E. The full form of E is Escherichia. Na? I think all of you know. So if you have this problem also, na, if you have infections, okay, if E. coli bacteria enter into your into your bowel, okay, or into your body, then what happens is that because of this E. coli bacteria you will have infections. Okay, that infection can cause inflammation in your bowel, okay, which ultimately led to exudative diarrhea. Are you clear?
Yes, ma'am.
Okay, next is motility related diarrhea. MOTILITY. Motility related diarrhea. So motility का मतलब क्या है? Motility, motile we used to call na, movement. You can move na, that is motility. Okay, motility relate to movement. So motility, it relate to movement na. So what is motility diarrhea? Okay, this motility diarrhea na, this is caused mainly by the rapid movement of food through the intestine. Okay, means like the food is moving, obviously whatever we used to swallow na, or whatever we used to eat, it used to move to our digestive tract, right? So when there is a rapid movement of food through the intestine, okay, you can also call it as hypermotility. Okay, hypermotility भी बोल सकते हैं. So when there is a rapid movement of food through the intestine, then there is a chances of developing motility related diarrhea. Are you clear?
Yes, ma'am.
Okay, or you can simply understand like this, na, that when the food moves too quickly through our GI tract, na, then obviously when it moves too quickly, तो क्या होगा? There will be very less time for the sufficient nutrients and water and all to absorb, ना. तो क्योंकि ये सब absorb होने के लिए तो इतना समय नहीं होगा ना, क्योंकि इतना जल्दी move हो रहा है, तो उसका वजह से there is chances of motility related diarrhea. Okay, and this type of problem ना, that फूड जो बहुत क्विकली रैपिडली मूव होता है ना इनटू इंटेस्टाइन, ये सब कंडीशन लाइक मींस लाइक किस किस डिजीज में होता है, जैसे कि ना इफ समवन इज हैविंग अ डायबिटीज एंड इफ समवन इज हैविंग अ हाइपरथायरॉयडिज्म. ओके, हाइपरथायरॉयडिज्म सुना? हाइपरथायरॉयडिज्म सुना?
No, ma'am.
एनीवन? Costa? Costa? Costa, have you heard? Hyperthyroidism. So hyper का मतलब तो high है, thyroid is related to thyroid, ना? So obviously this condition is the conditions or the disease that relate to thyroid, right? Means you
Yes,
can simply
ma'am.
understand like this, that when it is a condition now where the thyroid used to release the high level of thyroid hormone into our body. क्योंकि ज़्यादा thyroid होने से तो अच्छा नहीं है ना. So when our thyroid ना, when it used to release the very very high level, बहुत ज़्यादा high level of like this thyroid hormone into the body, then that particular condition we term it as hyperthyroidism. Okay. So when someone is suffering from this kind of disease or this kind of problem, hyperthyroidism, diabetes वगैरह, sugar level बहुत high है, तो ये सब condition में like motility related diarrhea होने का chances होता है. Are you clear?
Yes, ma'am.
Yes.
Okay. Next, the last one, inflammatory diarrhea. Inflammatory diarrhea. Inflammatory diarrhea. So inflammatory diarrhea, from the name itself, inflammatory diarrhea का मतलब inflammation होगा. Inflammatory diarrhea ना, this diarrhea it mainly occur ना when there is damage to our mucosal lining. Okay, जब हमारा mucosal lining पे ना inflammation होता है, then there is a chances of having inflammatory diarrhea. You know ना what is mucosal lining? Mucosal lining. Mucosal lining सुना? You don't know mucosal lining? Mucosal lining means what? जो moist area है ना हमारा, like हमारा organs पे, like there are many organs ना present in our body ना. So the moist area, okay, the moist, yeah, the inner lining of some organs, okay, those we call it as this mucosal lining. For example, like mouth, means the oral cavity na, the mouth, the nose, the stomach, all these things. Okay, are you clear with the mucosa? Means mucosal lining. कौन सा पार्ट को mucosal lining
Yes, ma'am.
बोलते हैं? ओके, moist part. अगर माउथ को खोलने से जो moist area है ना, the moist area, or the inner lining of that particular organs, okay, that we call it as mucosal lining. So when there is inflammation in that particular area na, that particular mucosal lining, then there is a chances of developing inflammatory diarrhea. I think you are clear enough na. And this,
Yes, ma'am.
and this inflammatory diarrhea na, all this inflammation that occur in the mucosal lining na, this is mainly caused by bacteria, viral, parasite, or okay, or many autoimmune problem also. Okay, all this, and बहुत सारा inflammatory bowel disease भी होता है, means intestine inflammation का disease जो होता है ना, वो सब का वजह से भी it used to occurs like this. So you just need to know that inflammatory diarrhea, it occur when there is damage to our mucosal lining. Okay, then it is mainly caused by bacteria and viral, parasite, or many other autoimmune problem, or else if there is any problem in our, like in our bowel, I mean like अगर bowel का disease होने से ना उसका वजह से भी होता है. So these are the 5 basic classification, okay, of diarrhea. That is, on the basis of duration, we got 2 points. On the basis of clinical presentation, we got 2 points. On the basis of physiology, we got 5 points. Are you clear whatever we have discussed?
Yes, ma'am.
Okay. So now I would like to tell you all about the predisposing factor. Okay. So predisposing factors means means the factor that increase the risk of diarrhea. Okay. There will be obviously some factor na, that will increase diarrhea. जैसे कि age. Okay. Diarrhea is more frequent in children under the age of 2 years. In children, ये जो diarrhea है ना, वो बहुत common है. Okay. In children who are under the age of 2 years. Are you clear?
Yes.
Yes,
Ma'am.
ma'am.
Okay, and then that is age. Next is season. Okay, season. Diarrhea is more common in summer or in autumn, or when it is common according to you. Diarrhea is more common in summer and rainy season. Okay, rainy seasons and summer it is common, not in as compared to that of the spring season, that of the autumn season. Okay, are you clear about the predisposing factor? Means the risks of diarrhea.
Yes, ma'am.
Okay, and then socio-economic status. Okay, socio-economic status. So diarrhea is more common in children from the very uh, low economic status family. Okay, the poor families. Okay, living in a poor sanitary environment, because some are living in the street. Okay, all those things and all. No, means the you can just mention it as low economic sector or low economic status, or as like the poor families. Okay, compared to those people living as a sedentary lifestyle, no? Means the low socioeconomic status are more susceptible to have these diarrheal infections. Okay, next, dietary factor. Dietary factor means like whenever, like in case of baby. Okay, in case of baby or we also. Okay, there is a risk of developing this diarrhea. Okay, in artificially fit children. Means like when the baby is breastfeed. Okay, when you are born, when your mother breastfeed you, then you have the less chances of developing diarrhea. Okay, as compared to those who are like artificially fit. Means like you apart from the breast milk, na, whatever food is used to be given, that we used to call as artificial food or artificial fat. Okay, so artificial fat children are more prone to develop diarrhea as compared to those of breastfeed. Are you clear?
Yes, ma'am.
Okay. Okay, that are some of the predisposing factor. Okay, so now there are some causes of diarrhea. Okay, obviously diarrhea होने से तो उसका cause होगा, क्या बैक्टीरिया cause करता है, वायरस cause करता है, और वो बैक्टीरिया जो डायरिया cause करता है उसका नाम क्या है, the virus that cause diarrhea, what is the name of that virus, the parasite that cause, the fungi that cause, what is the name of that this particular like bacteria, fungi, or virus, na, the name will be there, na. So would you like to know the name?
Yes, ma'am.
Yes, ma'am.
Okay, and then like let me explain the causes. Okay, the causes first, the drugs. Like when we take antibiotics ना, and the iron supplement. ओके, जब हम एंटीबायोटिक खाते हैं या फिर आयरन का सप्लीमेंट जो भी है, आयरन का टैबलेट, आयरन का सिरप जो भी है ना, हम जब लेते हैं तो देयर इज अ चांसेस ऑफ डेवलपिंग डायरिया, लाइक means the symptoms of diarrhea can be seen. So this is the other cause. This is the first causes. Can you get my point?
Yes, ma'am.
Okay. Next, the other cause is na dietary cause. So dietary cause, obviously from the name itself, dietary cause, it will all relate to food. So when someone is having a food poisoning, when you are allergic to some food, okay, you are eating that food, but you are allergic to that food. And overeating का दूसरा नाम क्या है? Medically, how we call? It start with B, B, B से शुरू होता है. Have you ever heard? If no, I'll tell you.
No, ma'am.
Very simple. Okay. Being eating. B-I-N-G-E. B-I-N-G-E. Being eating. Okay. Try to use the standard words. Okay. As you are in the medical profession, try to know all these things. Instead of saying, na, having lot of amount of food, it's more nice, na, that being eating. It's more nice to pronounce. Okay. So being eating, B-I-N-G-E. Okay, Jiban, please take attendance, okay? Only 5 minutes left. Okay. Done. Being eating? Yes
Yes,
or no?
ma'am.
Okay. So dietary causes में क्या क्या देखा? Food poisoning, food allergy, overeating. We also call it as being eating, or when you eat some stall food and all, na, all those can cause diarrhea. So this is the another causes, okay? And then like there are some other causes of diarrhea, okay, that cause infection. क्योंकि बावल में भी तो इन्फेक्शन होगा ना, वो सब इन्फेक्शन तो सब बैक्टीरिया का वजह से भी इन्फेक्शन हो सकता है, वायरस का वजह से भी, पैरासाइट का वजह से भी, फंगाई का वजह से भी हो सकता है. So the name of the bacteria that used to cause infection, you can write Shigella. Or else I'll send you all instead of like dictating. I'll send you all the notes.
Yes,
Okay,
ma'am.
ma'am.
Yeah, no, instead of
Yes,
dictating.
ma'am.
Yeah. I'll send you all the notes. So those are the causes, okay? There are some other like surgical condition also. All those, there is very less time, so I'll teach you all on the next class. So actually for you all, na, much details is not required, but it is good na if you know the details, whatever problem it is. So on the next class also, I don't think I'll be able to complete. It will take at least 2 days. The management is also very vast because the ORS management, the preparation, how it is being prepared locally instead of purchasing, all those things. And I hope you all also will want to know it. So I'll teach the management and all on the next class. You understand whatever we learned today?
Yes, ma'am.
Yes, ma'am.
Okay. Okay, Jiban, done with attendance?
Yes, ma'am. Done.
Okay. Okay, then that's all for today. Okay, thank you everyone.
Thank you, ma'am.
Thank you, ma'am.
Thank you.